Good evening, everyone. Thank you for joining the Oxford University Italian Society. This evening, we have the honor to host Emergency NGO President Rossella Miccio. Good evening, President Miccio.
Good evening, everybody, and thanks for having me with you tonight.
Rossella Miccio began her career at Emergency in 2000, after completing her postgraduate degree in peace building and conflict resolution at Uppsala University. Within various departments, Miccio has led and worked to develop the projects in Afghanistan, Sudan, and Sierra Leone during the Ebola outbreak. Moreover, she has led the expansion of the organization to 7 countries, and she has been part of the Italian National Council for Cooperation and Development. Since 2017, Rossella Miccio is president of Emergency. This evening, President Miccio will deliver a speech on emergency NGO, medicine, human rights, and equality in humanitarian practice. Then we will have 10 to 15 minutes of questions by our committee, followed by questions from you, our audience. So please feel free to leave your questions below, and I will be very happy to read them out to President Miccio. Until then, President Miccio, the stage is yours. You may begin your speech.
Thank you very much, and again, good evening, everybody. It's a pleasure and an honor for me to be with you tonight to talk about this journey that goes through many countries with one very basic principles, that the right to healthcare is a fundamental human right, and therefore it has to be provided to every individual without any discrimination and with the same standard that we would consider appropriate for ourselves and our family members. This is basically what Emergency since 1994 has been trying to implement in many different settings, going from war-torn areas such as Afghanistan, Iraq, heavily mined countries like Cambodia, or countries that were just coming out of a civil war, such as Sierra Leone and Sudan. And by doing that, by providing high standard and free of charge healthcare, we were also trying to practice and to give back what the Universal Declaration of Human Rights calls the inherent dignity of every human being. This is something that we really believe makes everybody equal. We have many things that are different one from another. The music taste, the color of the skin, political and religious beliefs, but one thing we have in common, and is our dignity. And therefore we have always considered the medical practice as a practice of dignity and equality for every human being. As I was saying before, we started back in 1994 in Rwanda, when the horrific news from genocide reached Europe. Our first team entered Kigali and restarted the surgical hospital and the maternity hospital in the capital city. Since then, emergency teams have been working in over 18 countries, building mainly hospitals, center for surgery, war surgery by the first, and then slowly we realized in these countries that victims of war were not just those who were injured by a landmines or a bullet or the shrapnels from a bomb, from an explosion, but were also all those people, particularly the most vulnerable ones, such as children, women, the elderly people, who could not access a proper healthcare system because the war has destroyed what was there before. Therefore, we started slowly to expand our activities, moving from war surgery to pediatrics, to obstetrics and gynecology, to general emergency and trauma surgery, till very highly sophisticated medical care, such as cardiac surgery. In Sudan, like we at the moment, emergency is running the only completely free of charge and high standard center for cardiac surgery in the entire African continent. And this hospital has embodied actually the idea of equality and dignity that we have, because is born from the idea that if we really want to be an agent of change, if we really want to put in practice the principles embodied in the Universal Declaration of Human Rights, then we have to share with those who have been not as lucky as we are the highest achievement of our medical science, that doesn't mean only to provide high standard surgical services in this case, for example, cardiac surgery, but also set up a model that really empowers the local community by providing qualified training to the local staff, by providing a model for a transparent management, which is something that is badly needed worldwide, starting by the first in our country, in Italy, but is really aiming at a real ownership of the project in the country. Our big dream has always been to become useless. We don't believe in the necessity of dependency of the so-called low-income countries towards the high-income countries. Therefore, our idea has always been to intervene even during the humanitarian crisis or immediate big emergencies with a different approach. That was not just providing the badly needed life-saving care in that moment, but that was also looking beyond the immediate need, trying to understand how to help the local communities to rebuild after the crisis. This has been the case of all our surgical intervention in Afghanistan, for example. Afghanistan is a country that perhaps you know very well, is at war since 42 years now. So there are people my age who have never seen one day without the war. I just came back from Afghanistan last week, and the situation is not improving, and people are really becoming hopeless. Well, in Afghanistan, emergency runs 3 hospitals and approximately 40 clinics, first aid post and primary healthcare clinics. And those hospitals have been, over the years, not just saving hundreds of thousands of lives, but they are now the referral center for residency programs for surgeons, pediatricians, and even female doctors who want to become gynecologists in the country. At the moment, we have 32 young doctors that have joined this residency program in our hospitals. And these are the doctors that will stay in the country, that will build the future of the country. And if this has been possible for a small NGO, we are not very, very big, but if we have been able to do that, this means that it is possible. It's a matter of a choice of how we want to intervene in this very complex humanitarian emergency, which is our approach, which is our philosophy, and what is the aim of our intervention, how committed we really are in building something sustainable. Of course, Emergency has been able to do that thanks to the professionality and commitment of thousands of doctors, nurses, technicians who have been joining us over the years, but also thanks to the huge support of a lot of volunteers in Italy and in other countries. We also have the pleasure to have volunteers also based in the UK that are supporting us by creating awareness about our work and getting and looking for financial support, and also of thousands, hundreds of thousands of individuals that decided to support us by donating even a very small amount of money, but put all together, it really makes a difference. And I think that what makes Emergency so special is also this sort of widespread support at really a transversal level, particularly in the Italian society, public opinion, that is giving those who are in the field the strength really to overcome the many difficulties that we daily face in implementing our humanitarian activities. And honestly speaking, I invite you all to have a look perhaps at our website to get more information also on how to support, but also how to join, because this is something that for us is very important. Emergency is a common project. And everyone who shares the principles and the values that are at the very essence of this common project, of this journey, is welcome to join and to come with us, even if for a limited period of his or her life. This contribution is really very much appreciated, and it's thanks to this huge popular support that we have been able to treat over 11 million people so far worldwide, to train over 10,000 health professionals in all these countries. And by doing that, we have also promoted practically what we call a culture of peace, solidarity, and respect for human rights. This is a key mandate for the organization. So on one side, we have the practical humanitarian work of our hospitals that is based on the principles of equality, quality, and social responsibility. So access, unlimited access, free access to everybody without discrimination, high standards of care, and gratuity of care. These are the three basic principles of our work. But at the same time, by doing that, we are also promoting a different way to implement the human rights and to practice a culture of peace, which is not based only on values and general principles. Our commitment to create awareness about human rights, peace, and particularly the right to healthcare, and for us to being so much against war, to try and solve the problems among states and among communities, is really as its roots in the operating rooms of our hospitals. So I personally have had the privilege over the past 20 years to meet thousands of victims of war, and they are the only reality of war. There is no other common ground in all the different wars that we have seen all around the world. The only reality of war is that 9 times out of 10, they cause a victim among civilian people, which means people like me and you. War is always a choice, and therefore it can always be avoided if the political willingness is there. And we believe, having seen the dreadful results of these choices worldwide, that it is a duty, a moral duty of the citizens of the world to speak out, to convince and to push those who can make decisions on war and peace to go into a different direction. Albert Einstein, it's almost 100 years ago, was saying that war cannot be humanized, it can only be abolished. And unfortunately, we have to say that his statement is so much true, perhaps now more than ever, because the technologies that we have developed so far are really giving us the possibility to put an end to the life of the human beings on Earth. And we have to take into consideration also that war is a huge tragedy in terms of public health, because not only it maims and kills and wounds people, but it also creates disabled that become a burden for their community, displaced people that are forced to migrate, hunger, poverty. It's a threat for the planet in terms of environment as well. And we are still seeing in many of the countries where we work the dramatic effect on the environment of the weapons that have been lethally used for many decades. It's a tragedy from the economic side, because if we consider the huge, gigantic amount of money that is put into arms and weapons worldwide, and how we could better use that money to build hospitals, schools, university, to create bridges among communities rather than to bomb those bridges with our weapons, well, then we can really start to imagine a different world and act practically to reach it. And this is basically what we have been trying to do since 1994 from 1994 till today. And I hope that we will be able to continue along this way with many new friends along this journey, and perhaps also some of you will come and join us along this journey of medical practice and human rights. So I think I can stop my speech here, and I'm very happy to answer your questions, if any. Thank you. I cannot hear you.
Okay. Sorry. Thank you very much, President Miccio, for your interesting speech and for telling us more about emergency mission and terrific results across the world. I would like to start this Q&A session by asking what has been the reaction of local communities during emergency interventions? In particular, in your speech, you talked about political willingness to aid emergency and its activities. What's your opinion on that, and what is your experience so far?
Well, local communities and local authorities are for us the key partner. So wherever we go, we always, the first step is really to introduce ourselves to the local communities, explaining who we are and what are the principles of our work, but also trying to understand what the real needs are for them and how we can combine our expertise, our skills with their needs. And I have to say that this, of course, is not always easy. Sometimes there is a lot of mistrust regard the NGOs, foreign NGOs, because sometimes the results of the work has not been so impactful for the communities. But then I have to say that once we start working in the community, then we have always had a lot of support and cooperation, and that goes really from the grassroots level of the village where we are up to the highest authorities of the country. And in some countries, in most of the countries where we actually work at the moment, we have also been able to involve the local authorities in not only in the, let's say, general framework of supporting an NGO, but also committing to contribute financially to the running cost of the hospitals, of course, without conditioning. So like in Sudan, for example, the government of Sudan is contributing by 50% approximately to the running cost of the hospital. And we have always been able to treat everybody coming from any countries, even countries that had no diplomatic relations with Sudan. Countries where there was an active conflict ongoing with Sudan. But this has never prevented patients in need of operation to come to receive a free of charge visa from the Sudanese authorities and the hospital to receive the needed funds. And I think that this is important, not just from the financial point of view, but it's particularly important because it means that the model that we are implementing becomes a value for those communities, and then is endorsed and supported also by the local authorities.
Thank you very much for your answer, and I would like to build up on that a little bit. You said that Sudan aids you in your mission in their country, but I'm also interested in the help that you may get from European countries, if you get any, and the role of Italy in your mission.
Of course, I mean, we try to have always good relations with the Italian embassy or the different diplomatic missions that are based in the countries where we work. And Italian cooperation, but also the European Union and the United Nations are also important partners and donors for some of our projects. I would say that all in all, the funds that we receive from these that are considered institutional donors, so European Union, both at ECHO level, which is the emergency office of the European Union, and the DEVCO, that is more involved with development projects, but also the Italian cooperation and the UN, they cover approximately 20% of the overall budgets of our activities worldwide. And at the moment, Italian cooperation is mainly supporting our activities in Sudan, as well as the European Union, and in Afghanistan is mainly the European Union and the WHO, so the World Health Organization, and the same for the new project in Yemen. Then the rest is all coming from our individual donors, mainly from Italy, but also worldwide.
Thank you very much. And now to move on from your initial speech, I would like to ask you if emergency has played a role during the COVID pandemic, and if you could talk about your intervention.
Well, yes, we have been playing an important role in Italy by the first, but our main concern, particularly a year ago when we first started to hear about this new virus before it reached Italy, our main concern was to make sure that the hospitals that we had in other countries would not be affected by this new virus, because we know how fragile those health systems are. Therefore, how important it is to guarantee the continuity of life-saving care that we provide there. So we built basically our COVID response on the experience that we had developed during the 2014-15 Ebola outbreak in Sierra Leone, where we developed internally and strengthened our guidelines and protocols for infection prevention and control. And of course, we adjusted them to this new virus. Fortunately, Ebola and COVID are very different diseases. But this helped us a lot in being able to immediately react in the countries in Africa and in Asia, but also in Italy. So we, in Italy in particular, we developed many different projects, not only in the health sector. We set up an intensive care unit for COVID in Bergamo that was the heavily hit area in Italy during the first wave of the outbreak. And then we developed projects to support the most vulnerable groups among the society, so the homeless, the migrants, the unaccompanied minors. But we also developed non-health initiatives, because immediately it was clear that COVID was not only a health emergency, but was also having a very important economic and social impact, particularly on the vulnerable part of the society. And we are still actually providing food support to several thousands of people in Italy, in different cities, that have seen their lives basically turned upside down because of the virus, losing their jobs and therefore their possibility to support their family. So people who were absolutely fine before the outbreak, the pandemic, and now they have no way to support the family, to pay the rent, and therefore we started to provide them some basic food support through a network of thousands of volunteers in several cities in Italy.
Thank you very much. And earlier on, but also now in your answers, you're telling us about the important role that volunteers play in emergency, but also professionals and experts in the field. Since in our audience we have many researchers, students, professors, I would like to ask you, how can they help? Where could they start their career, let's say, in emergency? And if you can give them any tips to how to start off their career in this sector.
Well, I started personally with an internship, so that's a possibility, definitely, both in Italy and in the UK as well, with Emergency UK. And then I think that there are many different ways to join emergency. For sure, I mean, we are very much convinced that the humanitarian field needs competent people. Being a good willing person can help, for sure, but it's not enough. Therefore, it's important to have people that have the right skills to really contribute to make a change. Therefore, we when it comes to field operations, we don't have, let's say, just volunteers going out on mission. We do have professionals that sign a contract with emergency, so doctors, nurses, administrators, technicians, logisticians, because they need not just to provide the services itself, but they also have to contribute to training. Therefore, this is something that I would highly recommend for those who would like to join us, to think about it seriously in a professional way, but keeping at the same time the commitment that gives you the strength to go beyond a pure job. When I joined the organization, the founder of the organization, Dr. Strada, told me something that for me has been like my light over these 20 years with emergency, was that, Rossella, if you want just to find a job, if you're looking for a job, then go somewhere else. If you want to join a project and give your contribution in a professional, but also in a passionate and committed way, then you're most welcome in emergency. And this, I think, is something that still makes the difference. So that there are a lot of things that can be done, a lot of also contribution that can be developed in terms of academic research, or even just supporting the organization by creating events for awareness, but also to raise funds. So there are really many ways that can lead the people closer to emergency.
That's fantastic. Thank you very much. And if anyone has questions about how to join emergency, how to help emergency, please visit the website. It's in the comments here. And or if you have further questions about the roles, please also feel free to leave a question, and I will read them to President Miccio. My final question for you, before leaving you to the audience, is more a personal question, actually. Nowadays, gender balance in power position is a crucial topic, especially in Italy. What's your opinion on the matter, and how do you think this can change in the future?
It is a big issue, honestly speaking, particularly in Italy. I have to say that, honestly, I felt really a bit disappointed when I saw the number of women in the new government that was recently appointed by President Draghi, and this tells a lot still on how long is still the journey that women have to do in the West. So sometimes we really think that this gender balance issue is mainly related to like Muslim countries, faraway countries, but then at the end of the day, it's also back home that we experience it. I have to say that this is something that we do not experience at all within emergency. I'm the third president of the organization, and and the other two were two women as well. So this is something that for us has never been an issue. So in terms of gender, actually sometimes we, particularly in the main office, our male colleagues complain that they are a minority. So we need to increase their share. But I understand that this is really an exception in the Italian society. Perhaps in the world of NGOs, this gender balance is I mean, it's less of an issue, but generally speaking, it is still a big problem. I honestly would love to stop talking about gender balance and to start talking about the right people in the right places, regardless of their sex or of their gender. But still, I understand that this is we are not there yet. It's and particularly for the young generation, this is something that has to be always in their back of their minds, because sometimes we give for granted what has been achieved and built through really a lot of efforts over the past years, and then it takes really very little to lose it all. So it's always important to remind ourselves the importance of respecting individuals and really making sure that the context is providing enough support to value the individual skills, regardless of the gender of the individual.
Thank you very much for answering my more personal questions, but I was very curious to know your opinion. And now this is the time for our audience to ask questions. So please feel free to leave them below, and I'll read them out. And we have received the first question from Sara Carrino. He says, the Manifesto for Human Rights-Based Medicine states that every human being has the right to be treated without discrimination. Why, according to you, equal access to coronavirus vaccines is failing poor countries?
Very simply, because we do not believe as a society in equality in rights and dignity of human beings. And I think that Sarah made really the point with the coronavirus vaccines is really giving us the example of how far we are still from truly believing in what over 60 years ago was stated in the Declaration of Human Rights. Emergency is part of a global alliance that is called the People Vaccine Alliance, that is really that is working actually to promote access without discrimination to COVID vaccines, but also treatments and diagnostics worldwide. But this is something that is very difficult to achieve. I am really very upset and shocked by the fact that even while facing the biggest threat to humankind that we have experienced in the past, let's say, 100 years, keeping aside the two world wars, that the humanity is facing, still we are not able to convince a few pharmaceutical groups to waive their intellectual property rights and share the technologies and recipes of the vaccines so that they can be produced in a sufficient amount to guarantee access to vaccine to all the world. And this is something that is not just immoral. I think it's also very stupid, because if we do not understand really that protecting every individual worldwide is the only solution to come out of this virus, this means that I don't really know what do we need to trigger this reaction, to go beyond really the profits of a few companies, and to really start to see the world for what it is, our common home. Therefore, we need really to take care of every individual in the same way.
Now we've also received a question from Giorgia Ramazzotti. Is pluralism in the humanitarian cooperation sector to be considered a value for the accomplishment of the mission, or is there a risk that the existence of many actors with a similar mandate makes coordinated management of humanitarian crisis more difficult?
What a question. No, I always thought that pluralism is definitely welcome. The real issue here is not the amount of different actors with the same mandate, but is rather the, let's say, the common standards that still are something that we didn't achieve yet. So the real problem is how to make sure that all the actors involved are respecting proper standards of care. I mean, unfortunately, I've seen a lot of different actors worldwide implementing projects that were really not effective, that were most of the times more beneficial for the agency that was implementing the projects rather than for the communities. And this I think is the real issue that the international humanitarian community should start dealing with, rather than the number of and the pluralism of actors.
Thank you very much for answering Georgia's question. Now we have some interesting questions. Please feel free to not to answer them, or to answer as you wish, in a way. So this one is from Victoria Lazzari. Thank you for taking the time to speak to us here today. I've supported Emergency since I first read about them some 10 years ago. I just read that you are a member of the Qatar Foundation. My question is, why does it seem incongruent with Emergency ethical integrity?
Well, we are not a member of the Qatar Foundation. We have been a partner of the OUIS, which is the World Innovation Summit on Health, that is supported by the Qatar Foundation. And the principles of OUIS are very much in line with the principles of Emergency and of most of other NGOs and humanitarian organizations, which are the principles of quality and equality in medical care. We have partnered with them to promote. They've co-funded our activities to follow up on the patients operated at the Salam Center, so to guarantee the continuity of care after free to the patients after the operations. That's something very important. And we have also shared and organized during their latest summit in November 2 panels that were dealing with the idea of quality and access to humanitarian help during crisis. So the principles are absolutely the same. They have never conditioned our activities or even our, let's say, willingness to speak out about the values and the reasons for our work. So at the moment, I don't see any incongruency with our ethical values and integrity.
Thank you very much. And now we move to Francesca's question. She's asking, a lot is happening at the moment in Afghanistan. The peace talks with the Taliban are ongoing. Withdrawal of US troops is being organized. The fragile health system is facing the coronavirus crisis. What have you seen in your latest trip in the country? What are the latest updates from the emergency projects there?
Well, I came back from Afghanistan 5 days ago. And on one side, I was very happy to see our hospitals resisted to the challenge, to the coronavirus challenges, because it was not an easy challenge to win, particularly because we had a lot of problems in sending international staff. Therefore, for many months, the national staff have received only a very limited support from the internationals. Nevertheless, I have seen hospitals that were well-functioning, clean, with a lot of committed staff. Unfortunately, these hospitals are also packed with patients. In Lashkar in the south of the country, in Helmand, heavy fighting, is actually almost reaching the city, the capital city borders. From the garden of a hospital, we could hear day and night the noises of bombings, shootings, and we could see then the flow of patients coming in. I've seen children, one in particular who is 5-year-old, so 1 year older than my nephew, whose brain was actually blown out. I'm sorry for these cruel details, but this is what war is. This is what I was trying to tell you before. By a shell from an explosion that hit his house. And of course, he has no fault. He has no responsibility. The war has forever changed his life and the lives of all his family members. And I think that it's really a shame that nobody is really talking about Afghanistan anymore. Nobody is really interested in the lives of the so many people that so far have been affected by this ongoing war. We try to keep the attention, to keep the light on it, but it's not easy. In October 2021, we will remember the 20th anniversary of this new war in Afghanistan. So hundreds of thousands of deaths, of millions of wounded, disabled, displaced people, and still no hope. Actually, everybody is very much afraid that the situation is going to get worse. It is already very, very bad. There was no cold winter, so the winter was very mild. Therefore, fighting did never stop. Usually, there was this winter break that, in a way, was helping people to take a breath. It was not the case this year. So we don't know. Everybody's waiting to understand what the US will decide to do. And this, of course, is this peace process that is not going anywhere, is creating also a more hostile environment for humanitarian actors. It's more and more difficult for us to move around, to reach out to the communities that need our help, and because there is really a lot of tension among the different parties. So we'll see. We'll see.
Thank you very much for your answer. I believe we have answered Francesca's question, and we have received so many thank you messages. Like, I would like to share some with you because I don't know if you can see them on the side. And also Victoria, who asked the question before, she said, "Thank you for your answer. I will continue to support emergency, and I have so much admiration for all that you do." Thank you very much. We also appreciate Victoria's comment. These are the questions that we have received in the comments. And before leaving you, we always ask this question to our guests. So do you have any fun fact that you would like to share with us? Any funny stories that you have experienced in your career?
Well, there are many funny stories. Well, I can tell you the last one. The day before I left from Kabul, actually. We were unfortunately, because of the situation that I was telling you before, that the war is getting worse and worse. Then we were doing some works within our house compound that is just on the other side of the road to the hospital. so it's just opposite the hospital. So I was at home in the afternoon because I was having a meeting, an online meeting, and then finishing the meeting, I had to go back to the hospital for a meeting. Well, I arrived, and there were the workers that were fixing this huge new second door, very big one, a strong one, iron and I don't know what, to let's say make the house compound safer. And unfortunately, they forgot that I was in the house and that I needed to go to the hospital, and basically they locked me in. So that it was everybody was really desperate. They started to call and phone. At one point, they came with a huge ladder and they wanted me to climb up on the roof and then go from the other side. So I said, please, I would like to go to the hospital alive, not as a patient injured. And therefore, at the end, they basically were able to talk to our neighbors. And since we had a common door between the two gardens, so basically we had to break the door, and I succeeded in reaching the hospital and going to a very important meeting, because we were supposed to go to the presidential palace to talk about the campaign for the equal access to vaccines. So it was really an important meeting, thanks to our neighbors and breaking his door, because I got locked in. And the Afghan staff was telling me, okay, Rossella, keep it as a funny memory for your last day in Afghanistan. So this was for sure. I mean, they had bigger problems than staying locked in the house.
Well, thank you very much for this funny story. I think we always appreciate stories that go beyond the work as well, like about personal stories. And thank you very much for sharing that with us. And this is the end of our interview. So I would like to say thank you to President Miccio for joining us this evening, for her speech and for answering our questions. Thank you very much for that.
Thank you for inviting me and for the attention to emergency. It's very important. We need really to be together and to be as many as possible. Thank you very much.
Thank you very much. And as President Miccio said, please do visit emergencyuk.org website, and please consider making a donation, because this is a very important cause. And finally, we would like to say that we hope to one day, once the pandemic is over, to have you in Oxford to have a speech in one of our colleges. Thank you so much.
I would love to. Thank you.
Thank you very much.
Stay safe.
Thank you very much. And also I would like to say thank you to the following people who have helped me organize the event. Emma Baldassari and Fabio Spagliardi, our secretary and IT officers. We also like to say thank you to Cecilia Corsini and Giorgio Ramazzotti, our press officers, and all the staff of Emergency who has helped us during the preparation for the event, for providing important insights into Emergency and its activities. And finally, our sponsors for allowing us to continue our activities, Banca Intesa. And this is it. This is our interview with Rossella Miccio, President of Emergency. And thank you for joining us this evening. Have a nice evening, and see you soon. Goodbye.
Bye.